Hello, one more time. That's what about we will talk today. Disorders of conscience. Topic is a bit uneasy. But we have to pass it. Are they, these disorders are common? Yes, quite common, and you will meet them. Maybe you already saw them, met them in your life. Or maybe even experience it, because some of these conditions are part of a normal psychological life. Well, as usually, what is the conscience? First of all, the definition. What is that? How would it work? Normally, before we enter into the description of the pathology of the conscience. So conscience, here is the definition for you. It's a state of awareness of self and environment. So you understand yourself, what's going on in you. You can see it, you can feel it, you can detect it, and you also in a contact with environment. With external environment, you do know where are you, what's going on. You see who near you, what situation right now happens, and you understand how you came to this process. That's in general, that's a conscience. But I would like you to understand conscience more deeply, let's say so. So in order to understand what is that, I propose you to turn on your imagination and let's say that conscience, we can make a picture of it if we imagine a screen, a big screen inside of your mind, in your mind. So this screen reflects the images from outside, the picture, the window, the roads, the screen, a place, everything around you, every images, every sounds. So the information about code, all external information goes to this screen. But this screen also contains all the information which go from inside. I mean your memories, your experience, your thoughts is also in this screen. Your emotions, your motivations, everything is in this screen. So it's like a kettle, cauldron, sorry. Everything is there. So that means that's the conscience. It's and we have a definition. Conscience is an integrative function of psychic that integrate internal and external world together in our mind, of course, in order for the better adjustment for the environment. It integrates vision, hearing, memory, thinking, motivation, emotions, everything it is. It gives them, for all this function, a common place to be together, to work together. So this is our conscience. And conscience, as you see, can be at a height, at its height, yes, mean active. We say active state of conscience. Let me type even. It is a active state of conscience. Well, that's this is a state when you absolutely oriented, then you in touch, then you in charge, then you in a contact with reality. For example, yes, then you perform a difficult task. Your thinking is working, your attention is vigilant, for if I can say so. So you see what's going on around you very carefully. You can see external world very clearly. You in a contact right now. But there is another condition, an opposite condition of mind. And we call it sleepy or sleepy. State of mind, state of conscience. And here it is. When it happens, well, first of all, that's the final destination. Yeah. It goes sleepy state of mind. It's or sleep, conscience in the sleep. Then we sleep. That's should be obvious. What happened and then we sleep? All the information from outside is switched off. Sorry? We cannot see here what's going on around us from outside. We can see what happening inside of our mind, inside of our imagination. Our imagination draw the pictures or make dreams, and these dreams can be strange combination of our fantasy, of our previous experience, of our previous thoughts, fears, of everything. So actually there is a few information which go from outside. It's possible, for example, if something is noisy but we still sleep, but yes, most of the information goes from inside. It's a sleepy state, or sleep conscience in the sleep, more correctly it will be said. And there is a transition states of a mind. Then we are in really in a transition from the active state of mind to the sleep state of mind, or sleep state of conscience. For example, then you can hear something monotonous, like this lecture. I cannot hear you, you at home, and nobody knows what is around you. So you listen to the lecture, you can look in the screen, and that's it. And you fall asleep. Or you can look in the screen, but at the same time, you switch your attention into the internal fantasies, into internal thinking, thought process, and you get concentrated, and you go in far in your conscience from this lecture, and even from your place where you sit, and you somewhere else in your peace of mind, in your space, in your inside space. So you somewhere between active state of mind and between sleep state of conscience. It's so-called unconscious trance. Unconscious trance reaction. There can be meditation, for example. Then you try to change, and you change your state of mind, and you change your conscience with the special practices. In this case, you produce a trance for yourself. Sorry, and the person guide his or her attention or his or her conscience into another state. It's not asleep, but it's also not total, not completely conscious state of mind. So in this, that's the so-called artificial trance. This is meditation. How we understand it in psychology. So that's a part of normal conscience functioning. And let's move to the pathology. When conscience is disturbed, what kind of function we can find broken? Orientation in time first. Should be obvious. A person just don't know what is going on, what happens before. He just disoriented. He lost in the time, and also he can be lost in the consequences of the event. He don't understand what's going on because he don't remember what was before a few minutes ago. Okay. Next is orientation in place. In this case, we can see a bit more. We can say that the impairment of conscience appears a bit stronger than a person even lose the orientation in a place. So he don't know how did he get there. Actually the same, because he don't remember the consequence of all events. And that's why he don't understand where is he and what is going on. What's the place he is in. For example, a person can see somebody around him. He can see that he is in the room, in the chair. Maybe he can see that somebody is talking to him. That's it. But he is in a hospital and you examine him, but he don't see that. He don't just grasp his conscience, so suppress it. So slow work. That's is not enough time to or speed to grasp the information, or capacity to grasp the external information. He just can see or can understand only obvious and thick facts from around. And the last things what can be broken, it's in a very severe damages, is the orientation in a person. Means he forget who he himself. He cannot tell you your name. He just lost. Who are you? Where are you from? No answer. He don't. Actually, these people usually don't understand the questions, don't answer them. They can react only for sounds by turning a hand or something like that, but they cannot tell you who they are, where they come from, or how to ask, how to check, ask the patient about the date, the week, the place, how did they get over there, what was here before, what happens recently, why are they here? They cannot answer you these questions. And this is so-called prima facie of organic damage in the brain. So these type of disorientation, usually in most of the cases, it is that a sign that something is wrong with his central nervous system. It can be basic, the leading damage, but it also can be secondary consequences of some kind of disease, internal disease, or intoxication, which seriously harmful for the functioning of the brain, like hyperthermia. Very high hyperthermia can confuse the conscience and can give all these states of conscience which can break the orientation in all these conditions. That's disorders of conscience, which kind of they can be. So there is a three group: dreamlike, depressed, and restricted. It's better to divide them into three forms, actually, to better understand the clinic of all of them. Dreamlike changes of conscience. And here we can talk about delirium. You see, attention, concentration, memory, thinking, orientation, all this stuff, all these functions, they are disrupted. Yes. Orientation. Thinking also, you see, muddled, is slow. Sometimes it is incoherent, so the person can be concentrated because the person cannot be concentrated, and there are a lot of errors in conclusion of something. We call this state of mind like a clouding of consciousness. Like a person, his head, there are clouds in his head. And of course, there will be some lowering of conscience, lowered level of conscience, like in trauma. So usually acute delirium is a symptom of acute brain edema. Due to different reasons, edema or subedema of the brain. So what happens in this case? In this case, we got a hypoxia. Hypoxia, acidosis, disturbances in metabolic exchange. So we have an acute catastrophe in the brain, which gives a signal that something is wrong. Alarm, everybody be alerted, we die. This kind of biological signal brain send for all the conscience. What happens with the person? Yes, so a person have a raised threshold for stimuli, means like he is deaf or he can hear you well, he can see well, he cannot understand you well and fast. So the threshold is big. So only very loud, very intensive, and very simple stimuli will enter his mind. Second, disorientation in place, time, but not in a person, of course. This person in time and a place, disorientation. But not of the person. He do understand what was going on, and visual hallucination. That's the main, one of the main symptoms of a delirium. Why? Why visual? Because visual area in the brain is the most wide and huge. And in case of a damage, so this area will give a dysfunctional signal for the mind, and it do. What is that? Usually, as you see, it's in animals or something, something threatening, something which cause horror or terror. They can attack you or kill you. So disorientation, clouding, slowness, auditory hallucination, hallucination of touch, they possible, but not so often. And here, the main maybe important things about these patients is that they are fearful and misinterprets reality, the behavior of even other people as threats. So they full of fear. They're scared in a panic. Their eyes usually widely open. Usually you can see how they're shaking, trembling from the fear, and they misinterpret reality. They can think that you is not you, you is an animal, a big animal, not a small animal anymore, and you can attack them. This condition, that's why these people, the people in this condition can be really dangerous and they require emergency hospitalization. Well, what else is pathognomic for the delirium is they work at night. At night, delirium at night, we can have development of hallucinations, but it improves in the morning. So in the morning, he even can fall asleep and recover totally. So here we see that, first of all, it is a bit unpredictable when will it start, but what is obvious that by the night, things will be worse. And relatives, those who close, they will tell you he lost his sleep. First of all, he's anxious, he afraid of everything, and in the night he starts to talk with somebody who he think is in front of him. So this is a classical symptom of the delirium, especially fluctuation during the day of a clinic, and the nighttime worsening. This is acute delirium feature. Another dreamlike state, there will be two of them. It's aneroid state of conscience. Aneroid states, it's acute flood of hallucinations in schizophrenia. Well, the definition sounds a bit similar with the delirium, like a dreamlike imaginary state. Person is not asleep. If prolonged, it can call it a twilight state. Actually, that's the same. Aneroid states and twilight states. But what's going on over there? A person can see, feel, hear hallucinations. And this is hallucinosis. So acute flood of the hallucinations. So usually person, schizophrenic person, is not usually, is an aneroid. Schizophrenic person is the observer of his hallucinations, and he actually have any damage in the brain. It's just acute development of his own internal fantasies. Of course, he cannot define them as a fantasies. He thinks that it happens, it really happens. So he is being absolutely exposed for that. He's sitting, he maybe have open eyes, maybe it's closed. So he observes all what's going on around him. Usually it's a very huge, large, grandiose hallucinations, like angels fight with the devil. And where can they fight? Not in front of you, they fight in the whole universe. So he can see the good force, black force, and a bad evil force, and they have a clash, and he can have to control, he have to give the orders, he is in charge, or at least he supply one of the part, usually of course positive part, with the energy or something like that. So he cannot distract his attention from what's going on, from all these grandiose things, what's going on in his hallucinatory world. From inside, from outside, you can look at this patient. You see that he is sitting. His face is a bit. Yes, his face represents a bit what is going on. Actually, it's a kind of a surprise, admiring, ecstasy, just slight signs of excitation, and he is there. He just breathe in and he observe all this stuff. That's it. In oniroid, a patient is observer. The difference with delirium, in delirium, the patient is the participant. He can see, he can run from his hallucination, he can jump, and hallucination usually threatening. In oniroid, hallucination is not so threatening. Well, that's it with the dreamy state of a conscience. What is left? One of the important things is left is a stupor. Stupor is a condition that person, you see, immobile, mute, unresponsible, but he is fully conscious in medical terms. He's not sleeping, and he can follow external objects. Yes, but reflexes are normal. But what's going on? This patient is frozen. Usually, stupor we can observe in a shock condition. Actually, it's a symptoms of a great total dissociation of a psychic from the body. Only body left, that's it. Every psychological functions, they isolated from him. So he isolated from his internal world, from everything what is going on. Maybe somewhere deep inside of him, he is oriented in himself. But in reality, it's a person who don't speak, who mute, who frozen, no movements, no mimics. He just sit in one position or lay in one position with open eyes, that's it. Stupor is the sign of a absence of movements, and that's usually because of fear, extreme fear, torpor. Now we come to the depressed state of conscience. Then the conscience is being depressed by some diseases usually. What kind of diseases? A trauma, hemorrhage, acute trauma, intoxication. In these cases, patients can have a torpor. Here it is, torpor. Sometimes we call it obnubilation. Sometimes it is called sopor. But in general, and most usual term which they use in English-speaking literature, it's a torpor. No hallucinations, first of all. That's the main symptoms of. There are no hallucinations and no delusions. Psychologically, this person is benumbed, is mute, almost mute. It's a great suppression for the conscience. The patient is apathetic, is slower, yes, and he cannot express himself clearly. Actually, they cannot speak. And you see, it goes as the result of severe infection, atherosclerosis disease, which include accident. So, no hallucinations, a very slower patient, slower in thinking, in answers, in reaction. So he too slow that he cannot grasp what's going on around him. He tried to maybe remember where he is going to or where they taking him from, but no capacities to remember that. his brain in the process of survive. That's why he just can see, he can understand only few of what's going on around him. Torpor is the beginning of coma. Torpor move then to the sopor. Sopor, it's just the same. The torpor, just if you leave alone the patient in the chair for a few minutes, he will start to lose his conscience. Actually, he will start to fall in a violent sleep condition. So he sleep, somnolence, so-called. And then he loses the contact with the reality. If we leave him like this, and if these accidents, cerebrovascular accident, this catastrophe in the brain will take its continuing development, there will be a coma. So that was a torpor. And what left is the restriction of conscience. In the next slide, we will see the exact examples of the restriction of conscience, but let's think what is that. Restriction. It's a key word. There are frames in the conscience which let us see only particular idea, attitudes in the mind. Well, awareness is narrowed in this condition. Like a shore and the horse. A person can see only one thing in his mind. Can see, can think, is been motivated only with one thing in his mind. Restriction of conscience usually appear in a stress condition, not in the damage on the brain, not in the organic condition. Organic condition can improve, can increase the possibility of occurrence of conscience, but of a restriction. But restriction, it's a product of stress around us. In restriction of conscience, there is, yes, some lowering of conscience. That means no colors, no, other world goes into the shadows. Only narrow area is interesting. And there will be disorientation in time and place. Yes. Because this, where are you, what's going on, what is the time, is now not interesting. It's not so important for the person. Time and place. Let me give you a most simple example of a narrowing of conscience. Is then a big dog is running towards you, and it's a really big dog. Great stress. Your conscience, your attention is narrowed to this dog, and your conscience and attention is narrowed to the idea, to the simple idea here, how to save yourself. That's it. Nothing more exists in your brains. Actually, it is exist, but it is in the shadow. It is lowered. And of course, you lost the connection with the time, place. You just run out and save yourself. That's it. Narrowing of conscience. A tree, I have to run there. I have to save myself. Otherwise, this dog will kill me, or I don't know, he do something awful with me. There's a horror and path, where and direction, how to run, and you save yourself. Later, then you will come for this place, and you will see the tree that you was able to climb on, You will be surprised. That's impossible. I can't do this. Why? Why you did it? Why you achieve it? Because your conscience was narrowed. You never ask, is it possible or not? Is it dangerous or not? No, no time for this. Your conscience is lowered until one idea, how to save yourself. That's one of the example. Another example of restriction of conscience is a twilight state. That's a condition in which we have a morbidly changed conscience, a break, and also there will be a relatively well-oriented behavior, twilight states. So person, like he is lost, he is lost the connection with the real world, like he is like asleep, but he don't sleep, his eyes is open and he do something. Usually he just wandering, I don't know, just walking with any walking with passing by without purpose, just trembling from one place to another place, or trembling, rumbling from one place to another place, and that's it. That happens, then maybe you saw that in the film, then person got a very, very stressful, very shaken and devastating news, like bum, and that's it. He just turn around and walk somewhere. He even don't know where, why, what for, where, how to go. He just take his belongings and go. And maybe someone will call him, someone will ask him, hi, how are you? He will answer automatically in well-oriented behavior, hi, hello, hello, but he don't pay attention for the external world. He completely is in his internal world, in the feelings of, could be in the contact with the feelings, but actually he is detached even from himself, and just he goes. That's a restriction of conscience. And the twilight states. Here another examples of restriction of conscience you see. In severe anxiety, patients are preoccupied with this anxiety. And that's so much that they don't orient what is going on around them. It can be an example of self-amnesia. Then person even forgets their identity and everything what is going on with him in the difficult situation. There can be a hysterical twilight states, as I told you. So the condition when person is dissociated from himself, isolated from himself, he do something, he goes somewhere automatically without understanding of objects, of his goals. He just do something automatically and he is dissociated. Hysterical twilight states, that's now we call it dissociated twilight states, conversive. Now topic, the next question is insight, but before we move to insight, we will make a small break. So shall we continue? Insight. Insight is also we got some. I thought there will be a question. Insight. In a psychopathology, insight. Psychopathology, psychology, we will discuss a bit about all these colors of insight. So in psychopathology, insight refers to awareness of the fact that there is something morbid, some disease is present in a patient. The awareness of mental disorder. If patient do understand that something is wrong with him, we can say this is that he has insight. If he don't understand, if he think that it's okay, no insight. Traditionally, you see that the lack of insight was interpreted like, was called a psychosis state. And neurosis, that was a condition when insight is present. That the bit incorrect. Of course, in most cases this is right, but usually psychosis, it's a condition when there is impaired reality testing. Of course, this is, of course, not an insight, yes, but besides, moreover, for that, there is no insight. For example, a patient, trying to, a patient is talk to somebody right in front of him. Well, first of all, the patient do not understand that what's going on with him, that something bad going on, that he has a mental disorder, but he also do not distinguish what is real, what is not, and he talk with his fantasy. In this case, he has impaired reality testing, distortion of the reality. Okay, usually we call it lack of contact with reality. In this case, we can say this is a psychosis. Psychosis, as you see, is dangerous condition because a patient do not responsible actually for the choices for his behavior. He can do, and for him it is allowed in his internal world, internal system of values, it is allowed to do anything because he lives in these worlds. For example, if he kills somebody, it is possible because he protects himself. He can protect his life, his motherland, his family from the imaginary, in our opinion, they are imaginary animals, but for him they are real, and he gonna protect, he should serve. He actually should do everything what in a normal world people would say he's a real hero, she's a real hero, but he act not in the real world. He has impaired reality testing and he can commit a crime. That's why psychosis can be dangerous. Not always, but it can be dangerous. Neurosis, it's then there is elements of, or completely, there is an insight. Well, that's in the psychotherapy, but let me demonstrate a bit more about insight of the patient. Well, first of all, patient understand that something is wrong. Patient is aware that of some phenomena happens with him. Then he recognizes this phenomena as abnormal. For example, he got an elevated, yes, I am being elevated, I'm on the top, I'm energetic. First he see, I'm energetic unusually. Then he do realize that this is abnormal. Then what is important, what he think about this phenomenon. Is it caused by mental illness? In this case, we can say yes. The level of insight is growing, but at the same time, he can do understand that something is wrong with him, with his psychic, he going crazy, but his explanation can be strange, like, Sorry, like he was poisoned by somebody. Like somebody did it with him. That's not because of mental illness. And the last state, component of insight is whether this patient do understand that he need a treatment and what kind of treatment he needs. If he do understand that, and he together with you as the doctor, that in this case, we can say this patient has an insight. Actually, in this case, it's a half, maybe 80% of the success of a treatment of the patient with mental disorder. If we achieve it, or if patient achieve it, that means we did our job properly. And that's maybe one of the difficult part of our profession. Insight in the psychotherapy, few words. Psychotherapy, as you know, can happen with the people who understand their motives, with the normal people who has no hallucinations or any, they can have some personal problems in the relationship. And what is insight over here? It's the condition they understand their own motives, yes, for example, and previously they wasn't aware. Previously, these motives was unconscious. We call it intellectual insight. That person understood something which he, before he actually refused. Unconsciously, he refused to understand. Who he looks like he forgot, but it was kind of a self-protection, but self-protection which was unfair. First of all, the condition, he was unfair with himself, and this protection make a bad game with him. And he understood that, and after he understands that, we call this insight in psychotherapy. Also can be emotional insight. As you see, it's the capacity to feel, capacity to give a response, or a person finally starts to understand something, emotionally understand something which he didn't understand before. For example, to forgive somebody for, I don't know, for that what they did wrong, and the patient can forgive, can let all these feelings goes from him, his aggression, his sadness, guilt, cry, and tears. So he let go the last trauma, and now he is free, almost free, free to continue his life in a new way, in a new manner. Now, depersonalization and derealization. Depersonalization is a change of self-awareness, and actually it's detached from his or her own experience. Actually, then a person is being detached from himself. The person is detached. Change of self-awareness. What do the people usually say? People say that I am, right? I'm not like I was before. I am changed. In depression, classically they can say, I do not feel joy. I do not feel anything towards things in my life, important things in my life. Used to, I was love my family. Used to, I was excited when I saw my friends, or then I met my girlfriend or boyfriend. But now I'm empty. I am empty. Like somebody took everything from inside of me and take it out. all feelings, all wishes, emotion drivers. That's it. Depersonalization. I am being changed. Derealization, same things, but about the external reality. Then environment appear unreal. People appear lifeless, unreal, or something like that. So people become changing. Well, reality is not as it was before. It is being changed. And here you see the example. It changed in experience of time, like everything is frozen around me, changes in the body image. My leg is gigantic, or my hand, I cannot move my hand because they become made of steel or something like that. That side, you outside of your body, or you observe yourself from outside, feeling what's going on inside of you. Depersonalization. Sorry. And derealization can be in a healthy person. Then they are tired. But also these symptoms can be the symptoms, as you see, of a lot of scope of the disorders like trauma, hallucinogenic drugs, anxiety, post-traumatic stress disorders, schizophrenia even. So that's very huge symptoms, but so as you see, you can meet it very often. But also what is very often the depersonalization and derealization is the part of the anxiety and depression. And these two last conditions very often in the life and in the practice you can meet them. Well, and the last final slide today we will finish a bit earlier. It's a motor symptoms and signs. We got tics. It's the symptoms of individual and very specific disorder like tic disorder. Well, tics, it's movements, instant movements, repeated movements. They can be stereotypic, so one by one. Usually they are unpredictable. Usually they are very intensive, very how to say that, impulsive and meaningless, like to move the shoulders, to raise a hand, to jerk your head, something like that. Or it can be vocabulary, they can be vocal, means a person pronounce, say something, scream something, absolutely surprisingly, unexpectedly for other people, like very acute and loud and very sharp sounds like ah or people can say something offensive, some curses or some swears even. Well, dirty words they can say. From the blue, like they have a discussion, like a boy, he gives a presentation in the school and immediately he screams dirty words in front of all the class. So that's a tic. Unpredictable. Usually, yes, tic can increase during stress, these movements, but sometimes with no reasons, and person cannot stop them. Person really suffers from that. Sorry, two other types, mannerism and stereotypes. They are the symptoms of a schizophrenia. First of all, mannerism, it's a very manerical, it's a very demonstrative, theatrical gestures. Usually you see that they have some some functional significance, but in reality, they address it to nobody. A patient with schizophrenia can do just like that. I don't know, that usually means I will start to read a poem right now, but he just do just like that, that's it. Then he make a he can make a movement with their hands, like saluting or welcome, or the signal like leave me alone or something like that, but nothing follow that. So it's a signal of the communication, very obvious and very demonstrative, but for nowhere, for nobody. That's strange things. One of the explanation of mannerism is then people talk to themselves, talk to the voices, talk to their imaginary world. And in this world, these gestures may be suitable, but we don't understand. We observe from outside, we can't see this internal world. That's why these manners, the gestures, are like, you can wave like this. For whom? For what? Actually, it can be addressed for the ghosts, and he can say that, okay, leave me alone, see you tomorrow, that was a nice evening, something like that. He say that, he give this gesture, but we don't understand why. Stereotypes. These are the repeated movements. They are regular, unlike tics. Yes, tics unpredictable, but stereotypes, just if they start, they continue, they predictable, they very stable, and they absolutely useless with no meanings, like this. You see the movement. It's stereotypic, it's repetitive, and patient practice that. If you ask him, what is that, what for? He can explain you something, cannot, but he will continue. If you ask him to stop, he will, okay, but then he will get back. It looks like his life, all his life is concentrated for that, something important for him, but nobody understands what is that. And catatonia. Catatonia, increased muscle tone. That's a fact, extension and flexion. And there are no voluntary, or the voluntary movements are abolished. Patient is immobile, mute, unresponsible. You remember Soper, yes? That's one of the name of the catatonia, but catatonia is the Soper or stupor because of a schizophrenia. Stupor can be because of the great shock, because of the patient is frightened. Eyes are closed, patient resists to open them, or sometimes patient resists to be, for example, if we ask him, if we put him on one of his side, he will turn back and return in a previous position. For example, if he is lying on the surface, or if we try to extend his numbs, he will bring them back. In this case, we can say it's a negativism. So he resists for any attempts to change his position. Again, no words, don't speak. But most commonly, we have a wax flex. We have symptoms of wax flexibility. A patient like a statue, but statue made not of stone, but made of wax. And we can do anything with his limbs. We can, for example, pull up his hand and let it go, but it's not gonna fall down. And he not gonna bring it back voluntarily. No, he will leave it and he will stay like a statue in this position. And he will keep this position for hours. Only after that, then he will be really tired. Slowly, his hand will go down. Or the pillow symptoms. Then you pull out a pillow from him, but his head will keep it positioned in a space. It will be covered, and it will be looks like he is on the pillow. And again, only after 2 hours, 1 hour and a half, at least 1 hour, his head will be upper and not attached to the basic surface of the bed. So this is catatonia, catatonic disorders of movements, which are very characteristic for the schizophrenia. Luckily, right now, nowadays, we cannot meet so often this symptom, because if we start treatments, we will prevent the development of such tremendous symptoms like catatonia, catatonic symptoms. Well, okay. Well, that's it.